Hello, we're going to be scanning with the Itero intraoral scanner on the Typodont. And let me show you the setup of the room. You're going to have the patient reclined in supine. If you have a delivery unit where the delivery unit is behind the patient, you want to scoot it to the side because you will be sitting at approximately 11 to 12 o'clock position. Be sure to push the light out of the way and make sure the light is off so it doesn't interfere with the scanning. And then we'll take a look at the scanner itself. This is the Itero module. Plug in over here, and let's take a look at the login page. So on this login page, you'll see Diablo Valley College, the director's email, that's Tona Steve, and here's the password. You'll be putting in capital SMILE, S-M-I-L-E, and 123. That's capital SMILE 123. And then from this location, we're going to have you scan with an existing patient, so select patients. And there's two choices here. We have an existing test patient or DA patient 1. Either of those are fine. Let's start off with test patient. At this point, we are going to select New Scan. Sorry, there we go. And then I want to bring your attention to the icons up here. So currently we're on the prescription mode. So our prescription is we're going to select the procedures next. We've already input all this data on the top, so you don't have to. In practice, you would do that. You are going to go straight to the procedure, and it has a red asterisk. So if you select procedure, you're going to select study model eye record, and this is going to be for a full maxillary and mandible and bite registration scanning. So let's select that. After that, we are going to the next mode, which is the scanning mode. And let's give that a moment to get set up. And while that's setting up, let me show you the wand. So it's covered with a protective sleeve. Let's slip that off. And this protective cover, which protects the lens, it's the blue cover. We're going to slip this off and place on the white protective cover. It's usually a one-time use cover. We'll be using it multiple times just for practice. When you insert it, it's key to make sure that it's flush to the mount, like that. And a couple things I want to show you about the wand. So you can see I have a small hand, so it's hard for me to hold. I hold it underhand like this. There's a vent here. There's a power button here. And then there's a second power button here. On top is a navigating pad if you choose to use it. Today I'm not going to demonstrate that, but if you did choose to use it, it's simply pressing both power buttons at the same time, and you can scroll through and navigate this way. We are simply going to use the touchscreen method over here. So if you take a look at the order of this, there's some simple directions to give you an idea of how the scanning will go. We always start with scanning the mandible, followed by scanning the maxilla, and then finally you doing the scan for the bite registration. And if you take a look, I'm going to sit here for a moment. If you take a look at the view screen here, this is where you're going to see the actual image of the tooth that's being scanned. And then in a moment, you'll see the scanning result in real time. Generally, if you are comfortable enough, you keep your eye on this view box here to make sure the position of the wand is correct. And then you can also check over here to make sure it's scanning. So let's go ahead and start. I am starting on the mandible, tooth number 17. And there we go, we're on 17. Before we start, I want to let you know the order of our scanning. The first surfaces we're going to scan is the occlusal. Next comes the lingual, and then finally the buccal. So the order is OLB, and the lady from Itero thought of an acronym, it's Old Lady Butt or Old Line Backer. So think of OLB, that's the order that we're starting in. So here I am, 17 on the occlusal, on the viewfinder. I'm gonna use my non-dominant hand to start the button. And there we go. I'm just a few millimeters off the occlusal surface. I'm dragging it up towards the bicuspids. When I get to the anterior, I'm just going to tilt it lingually a teeny bit and then move it over from cuspid to cuspid. And now we're back to the occlusal on the lower right. And I'm just going to keep following back to the occlusals. So now we're done with the occlusals. The next surface that we mentioned is lingual. So OL, here comes the lingual. I'm going to rotate the wand to the lingual, and I'm not going to be totally flat and horizontal. I need to be slightly vertical. So what that does is that helps get the interproximal surfaces. I am also doing a slight twisting motion as I go through, and that helps pick up mesial and distals of the teeth. Some people like to scan and then go back and edit. I prefer if you can just scan in one motion and not have to pick up too much and re-scan. So now we're done with OL, now we're going to buckle. So with my non-dominant hand, I'm going to help the wand rotate over to the buckle. And if you can see, I'm resting on the cusps of the tooth. I'm not totally flat horizontal like this. I'm slightly resting on the cusps. And then now we're going to start moving forward. As I'm going forward, I'm using a slight rocking motion. I'm going mesial, distal, rocking to pick up those interproximals. And then watch as I come to the corner, I use my non-dominant hand to help me guide around and retract the lip. And I come around to the facials of the incisors. And at 20, when I reach 24, I like to switch to my non-dominant hand. We leave the machine running the whole time. And then if I freeze like that, I am going to go ahead and start on the occlusal. If I ever freeze, I go back to the occlusal and it'll reactivate the machine and go to the buckle. And now we can start doing that rocking motion. If you take a quick peek up to the screen, you can see some blue showing up. The blue are the areas that I didn't scan real well, or the ones that have not been scanned yet. And you can see they're filling in as we go. And also you may notice there's some areas that are showing dark gray. You'll notice that each pass that you make with the scanner, it'll pick those gray areas up. And then the last part, so we have OLB, and then there's one more I didn't tell you that's called the incisal roll. That's to pick up the incisor area right on the incisal edge. And simply just do one or two passes over. On the mandible, you can get it all in one or two passes. And that's the mandible, so let's take a pause there and turn it off. So let's take a look at the viewfinder, and you can see it looks pretty good. You can also rotate it. There's a few areas that I missed. I'm going to briefly show you how to get those areas. Well, let's try to tackle those on the lower left by the molar. So to get those blue areas, we talked about the lingual side. I'm not going to start it yet, but the motion is, instead of horizontal like this, you're going to be slightly vertical, and you're going to do a twisting motion. So you're going to twist your way up. Now I also want to show you how to pick up, again, how to pick up interproximal on the buckle. If you are resting on the tooth, you're not flat horizontal like this, you're slightly on the cusp. And to pick up the interproximal, we're going to do a rocking motion like this to get the mesial and distals. Okay? And so, let's go ahead and move on to the next, which is the maxilla. So we select maxilla. It gives you the instructions on what you'll be doing. So before I was holding it underhand like this. Now I have to flip the wand over because the surfaces are on the maxilla. So now I'm holding it with the lens facing up. I'm going to start on molar 16. You can start on 1. I'm going to start on 16. And then surfaces are the same order, OLB. So let me get lined up here. we are going to work our way towards the cuspid. Generally, I'm not looking into the mouth, I'm just looking at the screen. If you need to look at the mouth when you start, it's fine, just be where the light is very bright. Just to get your bearings so that you don't lose track of where you're at, and use your non-dominant hand to help guide the wand along so that you're not drifting away from the surface that you're scanning, and to help track the cheek. Okay, and I'm almost done with the occlusal. And now here comes the lingual. So I use my non-dominant hand to help rotate to the lingual. And again, we don't want to be horizontal like that. We need to drop a little bit so that there's some verticality to the wand. And now we're doing a twisting motion. As I come to the anteriors, I can get more lingual. I can get more vertical with the wand. And now I'm heading to the upper left. Again, I use my non-dominant hand to help retract. And I have to say, it is harder to scan on a Typodon because of these silicone cheeks. They really grab. But in real life, I think you'd just be able to slide along on the tissue. Now we're on the buccal. So again, we're not totally horizontal like this. We want to be lightly against the cusps. And then we're going to do a rocking motion. I'm sorry, I'm getting stuck on the cheek there. There we go. Okay, as I come to the central teeth, I'm going to switch to my non-dominant hand, just like the mandible. And we keep the machine running the whole time. And sometimes it freezes up here, so I have to start on the occlusal to get it going again. And then I roll to the buccal, just so so they know where the scan is. There we go. Retract the cheek. And again, I'm not totally horizontal, I'm on the cusps. And I'm rocking as I go forward, using my non-dominant hand to hold the wand, and my dominant hand to help guide and retract. Oh, and I froze at the premolar, so here we go. Now I'm going again. So even sometimes the image will freeze, in which case just go back to the occlusal. There we go. Okay, and then the last part is the incisal roll. For the incisal roll on these, I might do 2 or 3 passes because there's more surface, these teeth are larger, there's more surface to cover. Okay, and then let's take a pause to look at the image that we've got. And so again, I do have some blue spots on the lingual here. So let me review how to get those if you need to. Those are really common spots to get on the maxillary. You're going to place this as vertical as you can, and the motion you're doing against cusps are a twist motion to pick up the medial and distal. To get the buccal, that motion will look like this. You're going to be lightly on the cusps, not horizontal like this, but lightly on the cusps at a slight angle, and you're going to be rocking mesial and distally to pick up those blue areas. Work your way around. Okay. Now we're moving on to the last portion of this. This is called the bite registration. This is when the patient, or I'm sorry, the typodont is in occlusion, so maximum intercuspation. And I'll try to do this one-handed, but you'll want to hold your typodont like this, I'm also going to sit my patient up, or my typodont up, at 45 degrees. And if you need help with this, you can have someone help hold that. So I'm going to insert it approximately by the first to second molar, and we're going to use a waving motion. So let me just show you what that looks like. We will hold that clamped, and the waving motion is up, down, up, down, up, down, until you get to the cuspid. So there's the first molar to the cuspid, and you're holding it in occlusion. Let me try to show you that again. There we go. And we're doing an up-down motion all the way from here to here. Let me show you what that looks like in scanning, and we'll go ahead and get started. Let's see if I can start that one-handed. Okay, and now you can see it's taken the top arch, the lower arch, and it's matched them up on the bite. Now we have one more to do, the bite registration on the left side. So rotate to the other side, insert, close the mouth, and start the button for scanning. So something to know is that for whatever reason, this scan is upside down. The maxilla is on the bottom, the mandible's on the top. It just flips the image, and it always throws me off a little bit because I feel like I'm not, there we go, and that's it. And there we have a complete scan. Maxilla, mandible, and bite registration. I ask that you do not press this next button, which will process it, and keep this forever. Since these are practice ones, we want to be able to delete it. So in real life, if you're emailing this, you would process it so that you retain this record of your patients, and then you can email it to the lab. But we are not, so we ask that you stop here, go back to scan, and it says, do you want to exit? Yes, I don't want to save this. Okay, and then we're back at patients.